Community Bridge program is a program we've developed for our patients to connect them to community resources that will allow them and support them in achieving good health. A social service manager will meet with patients and assess their needs for housing, transportation, food. These are social economic determinants of health that as a clinic we generally don't provide. Right now, when we have a patient in need, the nurse case managers are the ones that get involved. The nurse case managers aren't educated in the community resources, so a lot of time is spent trying to help patients. We hope in the future that with a social service manager, the nurses will be relieved of these responsibilities and we will then be able to take more patients into our clinic.
So, ella se llama Fiorella y ella habla español. So, si usted no le contesta, usted deja mensaje.
Many are unfamiliar with what the community has to offer them. They are often afraid to ask because of their low literacy and their inability to speak English. The social service manager will connect them with community resources where they can learn their rights as individuals living in the United States. For example, we have a number of patients who are day laborers, and there are places that we refer them to that protects them in terms of getting appropriate wages and appropriate hours for their work. At this time, we have a pilot program going with Northern Virginia Family Services. Northern Virginia Family Services sends us a case manager 5 hours a week to work with our patients. Already we have a waiting list, and this individual has been able to help at least 20 patients and connect with community resources. With this grant from the Inter-American Development Bank, we will be able to expand our service capacity as well as our patient capacity. We will be able to offer more services to our patients and connect them to the appropriate community resources. In addition, we're hoping we'll be able to take on 50 new patients.